Hey class, today we're going to be looking at patient record forms. These are the documents that takes all of that information we've been talking about. Things like the exam, the temperature, pulse and respiration records, the body score, etc., and puts it into a record. The actual form, the format that the veterinarian or the farrier, or in some cases the grooming salon, is going to keep on file so that they can look back at the history of their patient at any point in time. Vet records can look really different from every different facility, every vet, etc. So what we'll do today is we'll talk a little bit about some of the basics that we find on any form. I'll give you some examples of forms. They'll be cut in half because we can't get them to all fit on a slide. And then I'll show you what our form looks like that we'll be using for our lab. Our end of unit assessment for this unit, because this is all experience based and kind of learning about the process, rather than having a test in this unit, what you're actually going to do is create your own patient record form and kind of create your own procedure for examining an animal of the species that you would most likely find yourself working with in the future. So this is kind of some more background information to help you build to that. Okay. So the first thing we want to talk about is something called signalment. I think I've mentioned this before when Moose and Bear came in, but as a refresher, signalment is the term we use to describe the basic background information about an animal patient. This is found in any patient chart. A lot of this is actually found like on medication labels, even when your dog goes into a groomer, when they go in to a boarding facility, etc. This is the basic stats that anyone is going to keep on their animal, including things like barriers, all that sort of thing as well. So that's just the basic background information on that animal they're working with. That information is going to include the species. It's going to include the breed of the animal, the sex, as well as whether it's intact or neutered, and the age. Okay. These are the basic stats. There are some additional things you might see, like vaccination status, but these are the basic things that are going to be found in basically any kind of patient record and any record that anyone who's working with animals is going to keep so they know who and what they've come in contact with. This information can be used for a lot of things. Obviously, it's identifying the patient, but it can also tell us some information about things like potential health concerns, especially when we know that for lots of different species of animals, there are health concerns related to what breed they are, what age group they are, whether or not they can or cannot be bred. And so all of those small pieces of information are going to help us kind of start deducing down what could or could not be a potential problem for that animal based on that background. Okay. Next sections then of the vet record are the ones that really can look really wildly different depending on what the context is that you're looking at this. So this is the history notes and the visit record. This information really is most of what's happening during a physical exam. And again, it can look really different from one clinic to another, one profession to another. In some cases, different clinics will even have like different record charts based on the species. This is more common with like vets who only work with a specific species, or they only do one kind of procedure, like a vet who specializes in dental work or chiropractor, etc. Okay. A lot of times, what this section is going to do, there's going to be like the section for history and like why is this animal coming in, what's the big concern, but then there's going to be another section, which is really the bulk of the visit record, that looks at the 12 different key parts of the body and kind of breaks them down in a way that makes sense for that particular veterinarian's process. So it's their way of noting anything they see of concern and also like the positives that they note so they have that record for the future. Okay. So here is our first examination example record. You can see this doesn't really include the signalment like across the top as it will in others. It's actually right here. They've got age, breed, sex, etc. They've got some information on body score and nutrition, diet information, any dental information. They've got a section for teeth. What are the owner's concerns? General notes about the physical exam, including things like its behavior, Is it depressed, lethargic? And then what it does, and what I really like about this form, is it makes a really easy, quick, like section along the side for all those different areas of the animal, and what are some of the common concerns, so that that vet can really quickly go through and like mark, put a check mark or a circle or highlight exactly what issues they see. You'll also see that it's got some like medical history section right here. So that goes into those patient history questions. It can say like, no, they haven't seen issues. Yes, they have. And then a little brief description. This also includes like what sort of lab procedures are happening on this particular visit. Like, are they getting a dental? Is another lab? Maybe a blood sample. This one says fecal. So they take a feces sample to look for things like parasites. And it notes what vaccinations they've specifically had. The bottom of this just continues to go into some more information. It lists what services are being provided, what they think it needs, any information about like pending labs or follow up. It also includes an overview of the animal's body. So this is used for both dogs and cats so that they can mark any areas, like literally put a picture or a sketch or a note about where they see a concern based on the ventral or the dorsal view for each animal. This is a really good one. It's really quick and easy to use, especially with this section that goes through all of the different areas with just like some common concerns. Okay. This one is a horse specific farm. As you can see, I got it from horse.com. So this, again, same kind of general information. It's just how is it broken down? So you've got your signalment at the top, and then you've got the findings, and they use a different coding system. There's this excellent, good, fair, or poor for the different areas of that animal. Okay, you can see body condition, how is it moving? Because horse movement and horse like hoof and leg health is so important, they actually break down. So you can put notes for any particular limb of that animal. We go to the bottom. Again, it's just going through all of those different areas and making it super easy for that vet to just check, like, what do they see? This is a very efficient process because it's got all of that quick information. Check it, note what's wrong. Okay, here's our third example. This is a very old school simple form. It's got your signalman at the top. It's got a section for any notes. It's got the open-ended section to put in like notes about what was done, what's happening in the exam, what concerns they see, what they're trying to assess or diagnose. And then on the bottom, again, it's got those different areas. This is a very like more note qualitative intensive form because you have abnormal, normal, or NE, which is a like code for like concern. I don't know what their NE stands for specifically. Our form uses NGA, which we'll talk about in a minute. And then down here, they can elaborate. So this leaves less like check off, this is what I see, and more, yeah, this was weird. There's a note on the bottom about it. This last form then is the one that we use. It's a pretty basic form. It actually comes from Cornell University and their curriculum on veterinary medicine. So we have our signalment on the top. It includes some information about like who the owner is and their contact, as well as the animal's information. Chief complaint is, why is this animal coming in? And then there's a space for like other notes. A lot of times that might be like other notes about history, prior injuries, etc. And then we have the TPR section. When you do your lab, you won't take temperature, obviously, because you don't have the supplies for that. And for weight, rather than listing the weight of your animal, because for some of you that might be difficult to do, what we're going to do is put their body score in instead. Okay. And then the bottom of our form is just has all 12 areas. It has the marker, kind of like the last form. We have normal, abnormal, and what we call no gross abnormalities. So that means that there might be something like different with that system, but it's not something that's like causing like a major concern. It's not something that is contributing to any current problems. So, for example, musculoskeletal. Perhaps this dog like lost a limb when it was a puppy, so it's a three-legged dog. I would mark NGA on that. You know, not a gross abnormality. Like it's something that's obviously not normal. It will impact the health of the animal in the future, just due to weight distribution, etc. But it's not something that's causing any current problems now. Okay, you got each of the areas, and then you have space underneath to put in your notes. When you do your lab, I will expect that whether it's normal, abnormal, or NGA, sorry, my phone keeps going off, that you will still put a little bit of notation on the bottom. Even if you just see positive things, it's good to still record those positive things in the future because, again, that's what helps us to establish a baseline for an animal. Okay? So, why does this matter? Physical exams are really important to maintaining good health. And I think we've mentioned this before, but it allows us to do things like establish baselines. Okay? We know that there's a normal temperature range for species, but every individual animal is going to be different. The same for humans. 98.6 is the quote unquote average human body temperature, but that's for all humans. That's not your average temperature. You might be different. The same thing is true for animals. So regular physical exams let us know what's normal for this dog or this horse or this cow. Okay? Physical exams also allow us a way to provide early diagnosis of treatable illnesses or preventable illnesses. So going in, when you watch the video of the canine physical exam at the start of this unit, they talked about like its teeth and that it would need like a dental treatment somewhere in the future. Okay? Because they see some signs for concern, so they're going to put that on their radar and they're going to know to watch for that in the future so that it can be prevented from becoming something that's going to impact the health of the animal. Okay? Things like cancer diagnoses are really like prevented by good physical exams every year because you're going to notice there's a problem early on. It also allows us to do maintenance care. So thinking about some of those things like taking care of teeth, watching the weight of an animal before it becomes a concern. Okay? Patient record forms then contribute to all of those things. They provide our veterinarian or a farrier or a groomer or whatever the case may be a really structured approach to examining that animal. Okay? It's showing them all of the things that they need to make sure that they check through, make sure nothing is missed. It also acts as a really easy way for them to provide documentation about, hey, I see this starting, let's keep a watch on it, or this could be something that's a concern in the future. So they have those records to look back. It also means that in a future exam, if they see something that's concerning, they can compare. Was that wrong the last time they came in? Is this just normal for this dog to maybe walk with a slight limp, or has it been recently injured and that injury isn't healing properly? Okay. Good physical exams and good physical exam forms and like regular physical exams help to keep an animal healthy for as long as possible. When we look at our pets, when we look at our work animals, whatever the case may be, making sure that they're being regularly monitored by medical professionals, but also just by their owners who come into contact with them far more often. That's how we give our animals the longest, best life possible because we're cognizant and we're aware of what's going on and how they're feeling. Okay? So these are things I want you to think about as you go through and do your physical exam. I want you to think about what might make that easier for your specific animal. What are the areas that you would want to look at more closely? Maybe if you're talking about your horse, our physical exam form doesn't really take into account like some of the specifics for that animal, or for a goat or a cow, etc. Okay, so think about some of those things. How would you improve it? Because that's going to be your end of unit assessment, is to create your own physical exam procedure and your own physical exam form, and then think about how does going through this process help to improve the life of this animal or all these animals that you're going to work with in the future. Okay? So, as always, if you have questions, let me know. Hope this helped to clarify some things. Good luck with your labs. Have some fun with it. Spend a couple days interacting with your animal. Okay? Take your notes while you do it, but just enjoy the experience. Hopefully, learn some things, practice some skills, and I look forward to hearing and seeing how things went. Take care, guys. Nice job.